I just want to sleep for the whole day. I cannot sleep. Let me just open my phone.
2 hours later.
Let's call Umaira. Hello, Umaira. Hello. Are you free today? Let's play. Oh, okay, sure. Let's go. Hi, are you? Hi. My friend. Yes, please. Let's enjoy this. Sure. Let's go. Let's go. Hey, it's Umaira. There. Umaira. Hey. Are you okay? Let's bring her to the sick bay. Let's go. Let's put Umaira here. Nesby, can you call the doctor? Okay. Doctor, sorry for disturbing you. Can you help me? My friend is unconscious. Oh, where is she? She's there. Let's go. Oh, she's here. Oh, here is she. Can you leave her alone? Ointment? Okay, thank you. I think I need to do some blood tests. Staff nurse? Staff nurse? Staff nurse? Yes? Can you do me a favor? Yes, what is it? Please take her blood sample and take it to the lab for further tests. Okay. I need it as soon as possible. Okay. I'll be right back. Where am I? Hello, Myra. Are you feeling well? I feel a bit better. Actually, just faint just now when we are playing together. Do you want some water? Hello. Hello, doctor. Is this Miss Myra? Okay. We have done some blood tests on you from your blood sample, and Miss Umaira, we have diagnosed you to have anemia. But don't you worry, it cannot be dangerous if it is treated. Basically, anemia is when your red blood cells that are healthy is in inadequate amount. It can be treated. Don't you worry. What is anemia? Do you know? No, doctor. What is anemia?
Anemia is a global public health problem affecting both developing and developed countries at all ages. According to the World Health Organization (WHO), anemia is defined as hemoglobin levels below 12 gram per deciliter in women and below 13 gram per deciliter in men. If you have anemia, your body does not get enough oxygen-rich blood. The lack of oxygen can make you feel tired or weak. You may also have shortness of breath, dizziness, headache, or an irregular heartbeat. Mild anemia is a common and treatable condition that can develop in anyone. It may come about suddenly or over time and may be caused by your diet, medicines you take, or another medical condition. Anemia can also be chronic, meaning it lasts a long time and may never go away completely. Some types of anemia are inherited. The most common type of anemia is iron deficiency anemia. Some people are at a higher risk for anemia, including women during their menstrual period and pregnancy. People who do not get enough iron or certain vitamins, and people who take certain medicines or treatments are also at a higher risk. Anemia has been recognized in ancient times, but its understanding has evolved significantly. The first ever recorded mention of anemia dates back to ancient Egypt around 1500 back before century, where it was described as a condition related to a deficiency in blood, though the causes were not understood. However, the modern understanding of anemia began to take shape in the 19th century. In 1827, British physician William Cruikshank observed the relationship between anemia and the size of red blood cells, providing an early clue to its physiological basis. It wasn't until the discovery of iron's role in blood health in the 1800s that anemia, particularly iron deficiency anemia, began to be understood in more detail. The condition is now known to occur when the body lacks enough healthy red blood cells to carry adequate amount of oxygen to tissues, with causes ranging from nutritional deficiencies to chronic diseases and genetic disorder.
Do you know there are a few types of anemia? The first one is vitamin B12 deficiency anemia. It is caused by the lack of vitamin B12 that is essential for red blood cell production. It is due to the body's inability to absorb vitamin B12 from food. Other than that, there is also hemolytic anemia that is happen when red blood cells are destroyed faster than they can be produced, and this situation will lead to a deficiency. Sickle cell anemia is a genetic disorder where red blood cells are abnormally shaped and can block blood flows. It will lead to anemia and also other complications. The next one is something that is really common among everyone, which is thalassemia. What causes thalassemia is when a group of inherited blood disorder that has less or absence of hemoglobin production and causing anemia. Last but not least is the one that our patient is going through, which is iron deficiency anemia. The disease occurs when the body doesn't have enough iron to produce sufficient hemoglobin.
Oh my god, Jasmine. Hey, what happened to Myra?
She has anemia.
Anemia? Oh my god, poor Myra. Poor Myra has anemia. So I would like to explain some causes of anemia. First is family history. Having a family member with a type of anemia passed through families called inherited can increase the risk of anemia, such as sickle cell anemia. Don't worry, it is not contagious. So if you know someone that has anemia, you can't get infected by it because it is inherited. Second is anemia inflammation. Diseases that cause ongoing inflammation can keep the body from enough red blood cell. For examples are cancer, arthritis, and rheumatoid. Next is iron deficiency. Too little iron in the body causes this most common type of anemia. Bone marrow needs iron to make hemoglobin. So if you don't have enough iron in your bone marrow, you cannot make a healthy red blood cell. Next is vitamin deficiency. Besides iron, the body needs folate and vitamin B12 to make healthy red blood cell. A diet doesn't have enough of this and other nutrients can result in the body not making enough red blood cells. So you can remember these causes of anemia.
Anemia occurs when the body lacks enough healthy red blood cells or hemoglobin, leading to reduced oxygen delivery to the tissues. The symptoms of anemia vary depending on the severity and the person itself. One of the most common symptoms is fatigue. This is one of the earliest and most common signs of anemia. You may feel extremely tired even after resting. This happens when the body doesn't receive enough oxygen, thus your muscles and organs doesn't function efficiently, which will make you feel tired and weak. The next symptom is you might also notice shortness of breath, especially when climbing stairs or do some exercising. People that are diagnosed with anemia will easily become more tired because there's not enough blood that transports to the whole body. Well, another symptom of anemia is feeling dizzy or lightheaded. This causes by lack of oxygen to the brain, which lead to dizziness, lightheadedness, or even fainting in severe cases. This is especially noticeable when standing up quickly. Another sign of anemia is pale or yellowish skin, which is caused by a lower amount of red blood cell count. Low hemoglobin levels can make the skin look pale even when compared to the healthy person. There is also additional symptoms based on specific types of anemia. For iron deficiency anemia, patients will experience symptoms such as brittle nails and hair loss. Nails become weak, thin or spoon-shaped, which is koilonychia, and the hair may fall out due to the poor oxygen supply. Unusual cravings or pica, which they had a desire to eat non-food substances such as ice, dirt or starch. For hemolytic anemia, or we call as rapid breakdown of red blood cells, patients that are diagnosed with anemia will experience jaundice, which is they had yellow skin and eyes due to the breakdown of red blood cells releasing bilirubin. Next, they had enlarged spleen, which is splenomegaly, or the spleen may enlarge as it tries to remove damaged red blood cells from the whole body.
So, let's go over the different treatments of anemia. First, we have iron deficiency anemia. This is one of the most common types. It happens when your body doesn't have enough iron to produce healthy red blood cells. The treatment for this is pretty straightforward. The most common treatment is iron supplement, which can be in tablets or liquid form. In more severe cases, you might need an IV iron. Doctor also might recommend dietary changes to include more iron-rich foods like red meat, legumes, and leafy greens. As for the age range, all ages can be affected, but it's particularly common in children, pregnant women, and the elderly. Then, for the second one is hemolytic anemia. It happens when red blood cells are destroyed prematurely. We treat it with corticosteroids or immunosuppressive drugs, especially if it's caused by an autoimmune disorder. Blood transfusions may be needed in more severe cases. If there is an underlying infection or medication causing the issues, we will treat that as well. This can affect people of all ages, but it's more common in children with genetic conditions and adults with autoimmune diseases. Next, for the anemia due to chronic disease is linked to conditions like kidney disease, rheumatoid arthritis, or chronic infections. The key here is treating the underlying condition. For example, if it's kidney disease, managing that properly can often reduce anemia. Additionally, if necessary, we can use erythropoiesis stimulating agents, ESAs, to help the bone marrow produce more red blood cells. It is more common in adults, particularly those who have chronic illness, and is especially seen in the elderly. And then for the last one is sickle cell anemia. Sickle cell anemia is a genetic disorder where the red blood cells are shaped abnormally, which causes pain and reduced oxygen flow. Pain management is critical, and hydroxyurea can help reduce painful crises. In several cases, we might use blood transfusion. For some people, especially children, a bone marrow transplant might often occur through this is a complex process. This condition is most commonly diagnosed in infants and children. Those adults continue to manage it throughout their lives. So as you can see, the treatment really depends on the type of anemia as well as your age and underlying health conditions. The key is finding the right approach to correct the deficiency or treat the root cause of the problem. It's always a good idea to have regular checkup to monitor blood health. Then, do you have any questions or concerns about any of these treatments?